Remember, you get 1 minute. 1 minute to answer the question. This is part of our review. Which region of the brain is responsible for expressive speech? The prefrontal cortex, Wernicke's area, the Broca's area, temporal lobe. This is part of our diagnostic module 1, if you remember.
Dr. Lopez, I'm so sorry. I'm just gonna have to leave the whole thing. I can't answer. It won't let me answer.
Okay.
Okay. Thank you.
You can stay and at least watch.
Okay, that's okay. Thank you.
Mm-hmm. I am impressed. Absolutely impressed. Okay. That's all I have to say. AJ is super fast. So when we talk about the Broca area, that is part of your frontal lobe, right? So that is Broca for expressive speech. Broca area for the expressive, talking, being able to talk, the expressive speech. People with broken aphasias damage that primarily affects the frontal lobe of the brain. So you need to know what's aphasia is associated with which region of the brain. Ching ching. Possible test questions. Prefrontal cortex. Example would be communicating complex medical information to colleagues and patients effectively. Next question. Can be broken aphasia or expressive, right? Lewy body, we covered this yesterday. When you see Lewy body, what did I say yesterday? Lewy body dimension. All right, 100%, guys. Let's do this. What medications you do not give with Lewy body? From yesterday's review. All right, we have 21 answers. Do we have 20 seconds left? 22 answers. $24 answers in. All right, that's it. Lewy body, I am seeing things. Okay, what do I mean? Hallucination. When you see hallucinations with Lewy body, it is a expected part of the disease. Any hallucinations with any other condition, other than drugs, of course, right? If it's not part of the condition, then you give antipsychotics. Lewy body, you do not give antipsychotic. Lewy body, I'm seeing things, hallucinations, do not give antipsychotic. Hopefully, you guys remember this. It's an important point. You may see this again. All right, which lobe is primarily concerned with the visual processing? Temporal lobe, parietal lobe, frontal lobe, or occipital lobe?
Dr. Lopez, may I interject? This is for Stacy. Stacy, if you're still there, try the alternative, which is the www.kahoot.it as opposed to the QR code. I used the actual login and it worked fine. I had a little more trouble with the QR. So if you try and log in with the kahoot.it, you might be able to get in and stay in. Just a thought.
Yes, thank you. And the code is 348-700. 348-700. 2 seconds and go. All right, guys. Occipital lobe, right? Super proud of you guys. You guys pay attention. You guys are nailing. Okay. Occipital lobe, touch the back of your head. Occipital is for seeing things. Occipital lobe is the center of our visual process. Hey, guess what? When you are having, I got a hot mic, please. When you are having disorders of the occipital lobe, you are having possible, possible hallucinations. You go to the doctor, their eyes are perfect. Guess what? Hallucinations come from the occipital lobe. Don't forget, it's important concept. Not just remember when we teach you occipital lobe visual. What you understand after that, the second and third order is hallucinations, part of the occipital lobe, right? So you have to apply the content in a way that's applicable to practice. Which dopamine pathway is affected by imparkinsonia? Easy, right? Let's do this. Mesolimbic, nigrostriatal, mesocortical, tuberoinfundibular pathway. We covered the pathways yesterday. If you see, today seems so easy because you are already growing into the content. Be kind to those that just started, please. You are learning and you're mastering the material.
So I'm not able to answer questions. I don't know. It's not allowing me, and I don't know what to do. I'm in here, but I can't.
Yeah, I'm sorry. So you answer the questions on your phone and see the questions on your computer. You cannot answer the questions on your computer. You have to have two devices. I'm not sure if that helps.
Yeah, I have a tablet and a phone. I'm off the phone, so
Okay.
I'm
I
just
do
using. That's
apologize.
okay. I'll follow through. That's fine.
Yeah. So when you hear Parkinsonia, when you hear modem, any type of modem associated with antipsychotics, you are to think of one pathway and one pathway only. That's nigrostriatal pathway. Here you have a fight. There is the fight between dopamine and acetylcholine. So what is happening here is acetylcholine is winning, and therefore you have these symptoms. More likely, the issue on the test will be a blockade of dopamine. When you have a blockade of dopamine, you have an inverse relationship with increase in acetylcholine. Blockade of the dopamine leads to all extrapyramidal side effects, EPS, dystonia, parkinsonia, and akathisia. Points from yesterday. If you have any akathisia, dystonia, or any other EPS, you are more likely to develop TD later on in the treatment. That is important. You should memorize this. Okay. Long-term DT blockades cause TD, tardive dyskinesias, and is involuntary and involuntary facial movements. Okay, concepts that we learned from yesterday applicable to today's event. All of them. Which structure is connected to our response to stress? Keyword stress. We talked about this yesterday. 100%, guys. Get it right, please. Get it right. Is this the cerebellum, the thalamus, the hippocampus, or the hypothalamus? Am I missing the right answer here? Should have made it a little bit harder, shouldn't I? All right, we got 5 seconds. Pick your best answer and go. All right, hippocampus. Hippocampus, the big hippo with the big head, right? It's associated with short-term short-term memory to long-term memory. Hippocampus regulates memory, convert short-term memory into long-term memory, responsible for motivation, stress, hippocampus, stress, hippocampus, stress. Likely on the test, you will see amygdala as one of the answers. 50% of you guys will pick amygdala. Do not pick the amygdala. Amygdala is for fear, is aggression. Do not get this test question wrong. You see stress, think of a hippo that's stressed. Think of a hippo that converts short-term memory into long-term memory. Stress, a stressed hippo. Emotions and learning. Okay? Big head, hippo, memory, stressed out. Please do not get this wrong. Do not get this confused with amygdala. We covered this yesterday. Okay, which limbic system structure regulates memory and is responsible for assigning emotional significance to stimuli? Emotion, emotion. Keyword here. It's part of your limbic system. All of these parts, limbic system, hippocampus,
Dr.
thalamus.
Flores, you have to answer twice there. The same answer.
Oh yeah, so eliminate one of them. So maybe possible. Or it can be twice as correct. What do you guys think? All right. All right. So most of you guys are getting this is the biggest this is the one of the biggest pitfalls of students confusing the hippocampus, the big head, hippo, stressed with the big head memory to the amygdala, the stressed amygdala, the fear of smell amygdala, right? Amygdala connects to emotions, okay? It's an angry amygdala. So the amygdala is the mood, emotional memories, fears, anxiety, aggressions, emotions and aggressions. Not stress. Stress is the big hippocampus. Now, if you get a oatmeal, well, a raisin, and you smell that, it connects you to the past. My grandmother made beautiful, delicious oatmeal cooks. It almost transport me to her house, sitting in the porch, eating oatmeals. Smell, smell, amygdala. Write this down. Super important. What are the potential side effects of increased prolactin? The dopamine pathway, we covered this yesterday. Levels due to antipsychotic medications. What does it happen? What is the one condition that I said you need to know twice yesterday? Nausea, vomiting, diarrhea, visual hallucinations and delusions, increased heart rate and hypotension, amenorrhea, galactorrhea, sexual dysfunction, gynecomastia, and the good osteoporosis. Wow. Wow. Yesterday, I stressed about the pathway, the tuberoinfundibular pathway. There is a fight there, a huge fight between dopamine and prolactin. When prolactin is winning, you have bigger breast. gynecomastia, amenorrhea, galactorrhea, and sexual dysfunction. Highlight this. This should have been highlighted in my slide. Osteoporosis. Highlight osteoporosis. I also need you to know the 5 things that are prone to increase osteoporosis that we talked about yesterday, right? Lack of exercise, caffeine, smoking, weight bearing exercise, the lack of it, right? So you need to know the symptoms that will promote or help osteoporosis to destroy your body. You need to know that because that's important, and you need to know that the tuberoinfundibular pathway involves all these symptoms plus osteoporosis. A patient on antipsychotic medication experienced decreased libido or irregular menstruation on antipsychotics plus possible osteoporosis, most likely associated with the fight between dopamine and prolactin in the tuberoinfundibular pathway. Okay, what characterize typical antipsychotic? This is the first generation. Be careful. Questions often ask for the atypical. Pitfall here. I'm looking for the typical. Why is the typical antipsychotic? Why is it different than atypical? 5-HT2A, selective D2 receptor antagonism, dopamine receptor antagonistic, or target both D2, 5-2A receptors. All right, we have 15 seconds, 20 people answer. Gotta pick your mind. Better be wrong now, but don't be wrong on the test date. 22 answers, 5 seconds, and go. Done. Okay, what should I say about this? All right. So there is something about the atypical second generation that you must know. If you attend my psychopharmacology course, you'll see a chart there. The problem is with the first generation, there is a D2 blockade that's too high. I put it in the 80 percentile. When the drug reaches the 80 percentile of blockade in D2 in any of the pathways, any of the 4 pathways, you will have problem. So why it doesn't reach 80%? And why don't you have that problem on the atypical? Because there is serotonin lowering the dopamine pathway, the dopamine blockade to 60%. And that is the difference. Atypical, there is a 5-H2A. Typical, there is dopamine antagonist blockade. It lacks the 5-H2A. I cannot express how important this point is. You need to know that typical blockade of antagonistic. Sometimes they will not say blockade, they'll say antagonistic D2. Please write this down. Your test will likely come in several questions. D2 antagonistic. It may never say higher percentage. You'll say typical first generation D2 antagonistic. It's just a little bit layer to complicate your life a little bit more, but you will get this question right because now you know. So getting this question incorrectly here is awesome because that means on the test day, you will not fall for this pitfall. Okay. Which type of aphasia is associated with damage primarily affecting the frontal lobe? Kind of talked about this a little bit. Is the broken Reniker. global aphasia or anomic aphasia? Test taking strategy. If you see a diagnosis or if you see a terminology that you never in your entire life heard of it, is likely to be a makeup one. Never go for an answer that you never heard of it. We have the tendency to create those answers because people find it exotic. I don't know the answer. It must be this that I never heard of. Okay. So if you don't know the answer, never pick an answer that you never heard of because you are unsure. Please use that. It may give you another 3-4 points at the end of the day. All right. Which serotonin receptor is the target by the atypical second generation for their distinct properties? Typical, it targets the D2 antagonist or D2 blockade. Atypical second generation targets what? 5H7A, 5H3, T3, 5H2C, or 5H2A. All this we explained into our psychopharmacology course. You see how much detail there is for you to learn and master this content. There is many receptors. All right, we have 2 seconds, 24 answers, and go. I was going to say 100%, right? So these properties, I just want to take a side note. Each one of these properties and receptors, we need to know what they do. Guys, you are going to be a prescriber. You are going to put people's life at risk. You are going to deal with people at their most vulnerable point in their lives. Marriage is breaking down, finances going to the drain, they are destroyed. Your job is to make a marriage between science and hope, right? Where do you get the science? The books. Where you get the hopes from your therapy, the things that you learn. Okay. So knowing your receptors, you'll be a powerful clinician. You are able to mix match 6 different medications to achieve each of the symptoms that you want to target. Okay, it's very important. Don't just stop after you pass the board. I promise you, it'll be a rewarding to you and to your career. The dopamine pathway antipsychotics mechanism, typical versus atypical, super key. Atypical antipsychotic, there is something about it that's special. It's the 5H2A. That's your serotonin. Serotonin what? Antagonism. Serotonin what? Blockade. Not really correct. Antagonism, right? But there is something else. There's the 5H1A. The purple book never talks about it, but I promise you it's part of the atypical as well. Not very important for your task, but it's there. As you progress, you should know there is a 5H1A super important as well. Okay. For the book, for the task, 5H2A, atypical. Typical, dopamine antagonistic, dopamine blockade at the higher level, the 80% level. What is the most important function of the amygdala, right? The stressed, the angry amygdala, not the stressed, angry amygdala. The stress is the hippocampus. Is that the stress response function signal to the thalamus? Is the fear, anger, aggressions, and management, emotional memories, and anxiety prevention, memory process involving the conversion of short-term memory to long-term memory. We have 20. You guys are super fast. Let me just say. Guys, if you're testing soon, take some time off from work, right? You're about to face your most important test of your life. Nothing else matters. This, if you're about to test in the next 2 weeks, this should be like golden for you. This should be like a treat, right? So yeah, we're talking about the angry amygdala. Nothing else really matters at this point. The smell, the amygdala, aggression. She's angry. The amygdala is anger. Can't stay still, right? So the amygdala really is angry, super agitated, fear of smell, connecting memories from the past by smell. Which current nerve is associated with stick in your tongue? Ah, right? 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, or 12. Give you 4 options here. Which one is it? We have 40 seconds, 19 answers. Let's do this. Okay, so let's take a look here. Oh man, did yeah. So let's take a look over here a little bit on this chart. This is important. Do you need to know all of them? I would. This is a memorization. This will help you on a test. This will help you make assessment if somebody has a stroke. This will help you make an assessment with someone with Alzheimer's, maybe a little bit, right? So let's look at some that are super important, right? Let's start with the glossopharyngeal, right? So there's the modem of the pharyngeal and mascular accessory, especially the accessory, the posterior part of the tongue, posterior part of the tongue, right? And also that's important. Let's see another one that's important. Um, 11, accessory modem, right? The mastoid muscles and the trapezium. Can you do this? Do this. This is your 11. Think of a 1 on top of your shoulder. Do this. 1 on top of your shoulder. That's your 11. Another one that's super important is cranial nerve 5. Where is it? Trigeminal, right? That's your face, touching your face with different pins and needles and things, a cotton ball, right? Clench your teeth. That's your 5. That's another one that's important. Mastigation. So your muscles are mastigations. Another one that's important is 8. Muscles of the face. So people get confused. 5 and 7. I'm sorry, not 8. Okay. Alrighty. Know this because it's the easy point to most likely get one of these most important ones. Okay. Clock drawing test. What do you remember? Is it the speech and language, muscular coordinations and reflex? Test the patient's right hemisphere's functionality, or hearing and auditory processing. What does the clock drawing test screens for? We have 20 seconds, 23 answers. Anyone else forgetting to answer? I know some of you guys are in, but you can't participate. You have 10 seconds left. Wow. So when we look at the Clock drawing test. Write this down, please. This is the easiest point you can ever ask for in life. Right parietal or right hemisphere or the right side of your brain. All three answers means the same thing. Right parietal. Can't do the clock drawing test. Right parietal. Hear my voice. You will see things related to this again somewhere in the near future. Tracy, she's like taking over there. Clock drawing test. Why do you do it? Because it's fast. 2 minutes. Who do you give? All folks that you are concerned regards dimension. Which dimension is most likely to occur out of all the dimension? Alzheimer's. Break down the dimension between cortical, subcorticals. I give you 3 examples for the cortical, and I give you 3 examples for the subcortical. Should you know this? Yes. Okay. Clock drawing task. Can't do it. Right parietal hemispheres likely to be damaged. Okay. Which dopamine pathway is associated with the positive psychotic symptoms of hallucination and delusion? Easy. Easy points, 100%. Let's do this. Remember how I said that I put the pathways in 4 quadrants, and I'm able to say the right, the left, the right, lower left, lower right quadrant, right? And then when I do this, I really transport myself to the image, to what's happening in the pathway, so that way I never forget what's happening in the dopamine pathways. Okay, guys, we said that positive symptoms happens where? In the mesolimbic pathway. And what are the positive symptoms? Hallucinations, delusions, anything that shouldn't be there but are there. Negative symptoms. Where does it happen? In the mesocortical pathway. What is the negative symptoms? Is all the things that are taken away from you. Apathy, feeling down, sad, things that don't belong in your life. Anything that's added to it that also don't belong is a positive. Anything that's taken away is a negative. Right? So you know the dopamine pathways. So the question is, how come you got this question incorrect if you did? So this is where it comes, applying the knowledge that you learn into application. Okay? Mesolimbic pathway, mesolimbic, high dopamine, blockade of the dopamine there is causing I'm so sorry, the high dopamine in the mesolimbic is causing the positive symptoms. Positive symptoms means anything that's added, hallucination, seeing things, disorganized, that's added to your life that you don't need it. Negative symptoms, mesocortical, anything that's taken away from your life that you should have. Apathy, lack of a association with others, don't want to be or don't want to do anything. Okay, why is it happen? There is a D2 receptor in the mesolimbic pathway that treats hallucinations and delusions, right? So D2 antagonism there, right? Along with 5-HT2A. That's what we're aiming for the mesolimbic. Which part of the mesolimbic system significantly regulates memory, converted them short-term to memory, long-term? What animal am I talking about? Remember the animal, the stressed animal. Please don't get the question wrong for the stress animal, please. Is it the hypothalamus? Is it the thalamus, amygdala, or the hippocampus? 100%, guys. Come on. $30 left. I think you guys all answer. I should have given you really 30 seconds to answer these questions. I made a simple question that connects to what we learned yesterday. It connects to module 1 of the PMHNP 30 Days Walk to Success. Crash course reviews included. Ten seconds. Can't change your answer at this point, and go. The animal. Which animal is in a zoo and stressed? The big head animal. Hippocampus. Short-term memory to long-term memory. Okay, let's not get this question wrong. Hippocampus regulates memory, converting short-term memories into long-term memory. You have to imagine a hippo that's stressed. He has a big head. He converts short-term memory into long-term memory. He's in a zoo. Stress management. Hippocampus, stress management. Never fear, never aggression. That's the angry amygdala. Okay. Which lobe is responsible for process sensory information from touch and spatial awareness? I would say this is a hard question, but I don't think most of you guys think so. Is this the frontal, the partial, a parietal, occipital, or temporal lobe? You guys just rock. Absolutely rock. 15 of you guys answered the question before even I read. Guys, this will be available on our YouTube channel as well, okay? Woohoo! Parietal lobe, right? Parietal lobe. Tracy, you just took in the lead. AJ's right there. Sabi, TM, and Victory. Just calling it out, man. You guys are leading the pack today. So, parietal lobe, think about this. It's vital for sensory. Parietal is for sensory, all kinds of sensory. Sight, taste, hearing, smell, and touch. If you hear sensory, if it's a sensory, belongs to the parietal. I want you to write this down. Writing. Writing is part of the parietal. Writing and reading, right? But specifically writing. If the test question asks for writing, you say parietal. Which cranial nerve is responsible for shoulder and neck movement? Ugh. Is it the facial, accessory nerve, the trochlear nerve, a good name there, right? Or is the hypoglossal nerve? I have to confess, 11 and 12 always get me confused. I don't know why, right? But how do I distinguish them? What did I say? What's the numbers on my shoulders? What numbers in my shoulders? We have 22 seconds. All right, I have a 1 and 1 in my shoulders. That's 11. 1 and 1, sitting on my shoulders. That's 11, right? So move your shoulders, and the number one's bouncing around right here. 11. Don't forget, it's important one. Another important one. 7. Another important one. 5. 1, 2, 3, 4. Now 5. Sometimes 4 is associated with 2 and 3, so you can put that in the same bucket. 7 is your facial, and then you have 8, your hearing. If you hear everything is good, that's your 8. Then I get confused also. 9, the glossopharyngeal. So that's your gag reflex. Can you swallow? That's your gag. That's your 9, right? Then you have 10, vital for your life. When I was in a cadaver lab, we had to deal with cadavers that died like 2 years ago. And my Monday day was the worst day on my training because it was 8 hours test, 3 tests. We do an anatomy test of 100 questions. Then we move to the picture test. And then we move to the live auto board cadaver test. So they put you in the lab with 50 different cadavers, opened up, used for 2 years. You can barely see anything in there, and they will ask you live questions. And they ask you, what is the vagus nervus? The vagus nerve is at? And you got to find that little tiny line that connects to your breathing, right? So that's your vital signs, your vocal tone, your swallowing, dysphagia, and um, uh, other things there. But your vagus nerve, if that cuts off, you can't breathe. Your connection is died. It's like a wire there. Okay, so important. Marie, please ask your question.
Can I have? I lost my game pen. Can I have another pen again?
Yes.
Pen,
3, 4, 8, 700.
700. Thank you.
Yes. I'll give you a quick second to log in. Not very long. And 11. After 10, you have 11. You have a 1 and 1 jumping in your shoulder. It's not the devil. It's a 1 and 1. Nothing to do with the devil here. However, it's the shoulder. It's super
How do you
important.
log in with a code? Because I'm
Okay,
not getting the
you
page.
go to www.kahoot.it, not .com, IT. Okay, I'll put this in the chat box. Sorry, guys, I just want to help everybody else that's unable to log in or got kicked out. I'll put this in the chat box. www.kahoot.it. And then once you log in, you should be able to get the PIN code 348700. I am putting right now in the chat box, so that way you have a chance to participate and take an active role.
Thank you.
Okay, right here,
Thank you so
code
much.
348, good 700. Done. All right, we're getting started now. All right, so don't forget 11. Don't get it confused with 9, like seems like I always do. Right? 11 is super important. Also, another one that's super important that I don't want you to miss is your tongue movement. If I say the 4 most important here is 12, 11, 12. Okay, 12. Remember, Dr. Lopez moving his ugly tongue in the camera. I don't care how you remember. Make it fun of me, but remember 12. Okay, putting your tongue out, tongue movement, right, is 12. 11, 1 and 1 in your shoulders. 7 is your facial. Imagine yourself getting a facial in a beautiful spa somewhere in Thailand. All right. 5, trigeminal nerve. Right. If you have damage in that nerve, it's gonna hurt a lot. But 5 is the mastigation. Can you clench your chins? If you are going to dice and roll the dice and you're gonna pick 4, I would pick those 4. Do I want you to know all 12? Yes. Every point is important. Fight for every point. But those 4 is my favorites. Okay. Which dopamine pathway is associated with the negative depressive symptoms of schizophrenia? I could have just said depressive symptoms and ask you if you know the dopamine way. If I say which dopamine is associated with decreased libido, would you know? Which dopamine is associated with osteoporosis, would you know? Different ways of testing your knowledge on the same exactly content that we teach you. "22 answers, please. Got 5 seconds and go. 3, 2, pick your answer. Bye-bye. 19 of you guys got it correct. I hope the 2 that you didn't get correctly, it was a mistake. Sometimes we do press the buttons and we don't intend to, and I hope that is it. But if it's not, please know that mesocortical pathway is decreasing dopamine there. There is a decrease in dopamine, a mesocortical. Now you feel depressed, apathy, don't want to associate with no one. You want to stay in your bed all day long, right? So lack of a motivation, emotional withdrawal in schizophrenia, that is to do due to the blockade. When I say blockade, it means decrease. And if it's a negative, things that I shouldn't, that's taken away from me, from my best life, it's happening in mesocortical. Things that I added that I don't need it is the mesolimbic, hallucination, hearing things, disorganization. And then you need to know the nigrostriatal and you need to know the tuberofundibular. But you don't just need to kind of know, you need to be intimate with those symptoms because the test will get the first part of it correct at the end and state the second statement incorrect and will mix and match. If you kind of know, you will not get this question right. You will not. You need to know this like you know your name. Which symptom is not responsible for increased prolactin levels due to antipsychotic medication? Which symptoms is not responsible? Is not responsible.
Dr. Lopez, am I showing up twice on the board because I'm getting responses that I'm X number of points behind myself? I did get bounced out and
Yeah.
re-signed in. I'm just wondering.
I can't see.
Oh, okay.
I can't see who's in the board. I can only see the 5 leading
Gotcha. Okay.
gamers.
I was like,
here.
how am I behind myself when it's myself? I did have to sign back in. All right. Sorry to interrupt.
Well,
Thank you. It's no big deal.
No,
Thank
yeah,
you.
no worries. You're never interrupting, and pick the one that you are winning. Okay, pick the one that have the most points. 22 answer, 10 seconds. You know the prolactin. Who is fighting, and where with prolactin and dopamine? Perfect, excellent, great job. I ask not responsible, not part of it, right? Galactorrhea, decreased libido, osteoporosis has to do with the fight between prolactin and dopamine, where tuberofundibular pathway, hearing my voice, get the question right. That is your final destination. Getting the PMHNP board certification is where you belong, and this is where you will arrive to. Okay. Ooh, this is a hard one. What is the definition of a stereognosis abnormality in the parietal spatial, right? What is an example? A stereognosis. Be careful with the A in front of it. This is a hard question, but 14 of you guys don't think so. All right. I thought this was going to be a little bit harder. You guys make me so proud. You are awesome. Let's see. I don't know if I have um, an answer here, but let me do it before. So if I close my eyes and get this here, I don't know what this is, right? So I got I'm tracing with my tactile hand. I am looking. It's a little bit of a square. Oh, it plugs in. Oh yeah, this is a USB port, right? So I open my eyes. I'm correct. That is ability to sense, right? It sense what it is. Usually this is given with the key, right? So this is stereognosis. You can recognize a stereognosis. You cannot recognize. So sometimes the questions that you get wrong is not about knowledge, it's about the details. Stereognosis, right there, right? A is the inability, lack of, don't have. All right, which of the following antipsychotic medication do not have 5-HT2A specific serotonin antagonism? Is that clozapine? Is it olanzapine, risperidone, or haloperidol? Guys, again, you have the knowledge. We break this down. We beat the dead horse. Now I'm applying the knowledge that you have. We teach you all about this transporter here, the VMAT2. Super fun to know for all your medications. Who is the transporter? How does it work? How it does not work? How is the enzyme broke down? Why do I care? Which receptors involved for each of the medication? Why do I care? First, I like to take care of my patients. Second, I don't want to be sued. Okay? So here again, you got the knowledge. Now I ask the same thing 3 times in a row in a different way. If I recognize that my second generation, my atypical generation is the clozapine, the olanzapine, the risperidol, and I ask, does not have, out, none, nada, is your first generation that does not have 5-HT2A. Second generation, 5-HT2A, your friends. Okay. I asked this question 3 times in a row in the 3 different ways to test your knowledge. Which dopamine pathway is responsible for prolactin level change? Wow. You guys are dominating this, right? So we're hitting on the prolactin. That in that pathway, there is a fight. Is it the mesolimbic, the tuberoinfundibular, nigrostriatal, or mesocortical? 3 seconds go fast and now. All right. Maybe it was a little too fast. The fight in the tuberoinfundibular pathway is between prolactin and dopamine. Prolactin is winning. You have big breast, irregular menstruation cycles. Libido is so low that does not even exist, right? And by the way, you remember yesterday the 2 things that can cause decreasing libido in older females? If you do, give me a thumbs up. You need to know that. If you don't, please, I'm not going to tell you. You need to watch our videos, okay? Now, Osteoporosis, tuberoinfundibular pathway, you need to know, along with what cause or promote osteoporosis. Okay, so here is a little reading for you to do. I think we beat the dead horse on this. Moving on. Okay. Okay, how do I move on? Here you go. Boom. Which limbic system structure is connected to our response to stress? Who's stressed? Who's in a zoo? Who has a big head? Is it the medulla, the hippocampus, the thalamus, or the hypothalamus? All right, we're getting there. We are improving. I like that. The hippocampus, he's stressed, he's in a zoo, he has a big head, converting short-term memory to long-term memory. So if the question comes with short-term memory, you think of the hippocampus. If the question asks about stress, think of the animal in a zoo being very stressed, the hippocampus. Do not pick the medulla. Next question. True or false? True answers 50-50. You can do this. Fast. 20 seconds. Performance impairment in the clock drawing test indicates damage to the left parietal. Is it true or false? Clock drawing test. Left parietal. True or false? And go. False. False. It's the right parietal, right hemisphere, damage in there. Clock drawing test. Why do you do it? 2 minutes, fast, reliable, indicates right parietal, right hemisphere, or right side of the brain. All the same thing. Fast, reliable, damage to the area. Right. Right? And then when we say writing, we say parietal lobe. All the sensory, smell, taste, all the sensories, parietal lobe. Agnosia is the type of sensory perceptual disturbance that can occur in partial parietal lobe. True or false? 15 seconds, super fast. Pick your answer. 18 answer, 10 seconds, and go. True. Parietal. Sensory. Can you sense with agnosia? Same information, asking you in a different ways. See, when we apply the information learned, we think about it and we make scenarios in our head. How can the question go? How can they trick me? And then we won't get tricked. But you know, the parietal is about the sensory. We just talked about that. And we talked about agnosia few slides before. So connecting what you learned to application. All right, Tracy, Janet, AJ, CB, TM. I think the board just changed a little bit. CB and TM are killing it in a row there. JR is making the comeback in third, 3 in a row. The tuberoinfundibular again pathway is responsible for modulation of motor movement. Tuberoinfundibular, is that motor movement? True or false? Go. 10 seconds. Wow, 20 answers already. Who's fighting in the tuberoinfundibular pathway and why? What's the response? False. 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 Motor movement. Where is the fight happening? Somebody give me the answer, please.
Nigrostriatal pathway.
Who's fighting in the nigrostriatal pathway? Unmute
Dopamine.
yourself.
Dopamine and
Dopamine.
acetylcholine.
Okay, I
Increase,
see it. Yep.
Decrease dopamine where we have EPS and stuff.
Okay. Decrease dopamine. Acetylcholine is kicking his butt. Pam, pam,
Mhm.
pam, pam, pam. Now I can't move. I'm all twisted around. I'm having dystonia. And if I do that, I can give cogentin. If I have long term use of an
TD.
antipsychotic, I get TD. And there is a slew of other EPS. Guys, if you do not know your dopamine pathways in detail, you will miss this question because they will make that's probably one of the questions that will make the most complicated. But again, it's easy. We have it right there in your program, easy, right? Most of you guys are getting, and I promise that the all of you guys are getting, you are in the program. If you're not, your job is to tell me how am I not explaining it to you well enough? And my job is to say, I got it. What is you not understand? Let's clear things up, right? You not understand is not your fault. It's my fault. You need to tell me, hey, Dr. Lopez, I don't understand. What the heck are you talking about? Explain it better. Do it a better job. And my job is to find a way to make you understand about this content. Okay. Your failure is my failure, and I take that personal. So I will not let you fail as long as you communicate with me. Okay. I can't read your mind. I look at my points. I know where you are. I know each one of you guys by first name. I promise it that I do. I'm not a stalker. I don't look at your Facebook profile, but I know you. When you're completing the course, that it is a dopamine hit in my brain. Okay. But you need to tell me, I completed, I don't understand, and I need to help you. The patient with weakness, aphasia, has difficulty understanding spoken or written language. You have 15 seconds and go. Is that true or false? Weakness, aphasia, receptor aphasia or expressive aphasia, broker or winkers. All right. Expressive aphasia, I'm talking is the broker receiving, right? Aphasia, understanding the words that come out of your mouth, making sense of it is your Wernicke's aphasia, right? I mean, Wernicke's portion of it is in the is the in the frontal cortex. You understand, right? Is your Wernicke's, right? So it's true. Same content, different way of asking. Trace, Janet, CBTM, you guys are killing, or CBI, you guys are killing. Trace, you are like 19 answers in a row. What's going on, Trace? Are you cheating, Trace? No, I'm just kidding. This
No,
is
I'm
your,
not.
I know you're just like feeling it. 19 in a row. Wow. You couldn't be cheap. I know. I apologize. That's not what I meant. I'm just
Oh, I know. It's okay.
wowed. I'm wowed by your knowledge. I'm inspired by your knowledge. That's what I meant to say. Now, the middle is responsible for attributing emotional significance to stimuli, emotional memories, and key role in fear. Is that the amygdala? Yes or no? 17 seconds go. Is this the hippocampus? The thalamus? The hypothalamus? 22 of you guys already answered, so I don't have nothing else to say. All right. I think you guys keyed in incorrectly. Okay. 17 of you guys got it. 5 you didn't. So I'm going to pray that you keyed in incorrectly. The angry amygdala, part of your limbic system, she's angry. She's nasty. She smells death. Is the amygdala. Please help me if I'm not making sense to you, if my ways of saying is not fun enough that you remember, if my way of saying things is not helping you. Okay, so I trust that you keyed in incredible. Amygdala, part of the limbic system, smells. The raisin, my grandma, brings me back to the best time of my life. Amygdala is my grandma or my grandpa spanking me with the with leaves from a plant back in the day because I didn't do what I needed to do. He was angry, fear. I was in fear. I was in shock. I said, "I'll never, Grandpa, leave my lights on again. I promise you." That was his amygdala beating me up. But also great time with my grandma, smelling the great oatmeal, the raisins, right? You need to make a story that makes sense to you. This makes sense to me as a true story. It brings me memory. In fact, I still think the one person that beats me all the time when I was growing up was my grandpa. And I thank him for instilling in me good living habits. Don't leave the lights on. Don't throw the soap away. Eat all your foods. Only put food on your plate that you are going to eat. Don't eat with your eyes. These things, it hurt me back then. I didn't like it, but did they serve me well? You betcha. Visual hallucinations are associated with what type of dementia? Alzheimer's, Parkinson, vascular, Lewy body. 13 seconds. You gotta be fast to get this one right. Two seconds and go. Okay, Lewy body. I am seeing things. I do not give antipsychotics. I don't want to kill my patient and make my patients even more angry or sedated. All antipsychotics are sedated. The least sedated is somebody give me an answer. Unmute yourself, please. I can't move until you give me an answer.
Abilify.
Abilify. Okay. Give me 3 antipsychotics that are skinny. Don't give me Lamictal. Lamictal is not antipsychotic. 3
Now,
Zal.
Gel.
Budan, Abilify, and Latuda.
Abilify and
Okay. It's not Zell. It's a trick question. I ask 3 antipsychotics. If I ask you for a mood
Oh,
stabilizer, give me Lamictal. Okay. Great job, everyone. Which antipsychotics should you give with food?
Latuda.
Latuda. What else? There is one more.
Geodon.
Geodon. 350 and 500 calories. Give me 3 antipsychotics that are long-term injectable. There are more, but give me 3.
Invega,
Risperdal.
Geodon, Abilify.
Held
Okay. How do we convert a pill to an injectable? How?
20 milligram times the dose. The daily dose.
Up to 100.
Okay.
And don't give
So the
not
dose
more
is
than 100.
Daily dose times 20.
perfect. The daily dose, the
Times
question may
20.
give you a BID dose. Are you going to get the BID? No, no, no. Well, you're not going to get one dose. You're going to get the complete dose for the
Dose.
days. Multiply by 200. If
20.
it's more, yes, by 1. Sorry. Yes, 20. If it's more than 100, divide the test. Do I really care when is going to be the next dose? Real life, yes. That's most likely, say, 2 weeks, a week. Importance, how to. Okay. All right. Next question. Okay, very fast. Hypothalamus is crucial in regulating what in the body? What the heck? Appetite, circadian rhythm, temperature, or all of the above? Actually, 1 minute. You don't have to hurry, right? So let's highlight the hypothalamus here because it's very important part of our body. It lives under the limbic system along with the thalamus. the angry amygdala, the fear of smell, the angry hippo converting short-term memories into long-term memories. I give it for stress. 23 answers are in. Are we missing anybody? What the heck does the hypothalamus do? All right, guys, if you're in my course, you know what the heck means, and you get this question right. So, yes, you know, that's the water, that's your body temperature, that's your hungry appetite, that's your vital signs, right? The temperature is so important. That's part of your what the heck acronym. That is possible side effect of blocking D2 receptor in the tuberoinfundibular pathway. We covered this like 10 times today. 20 seconds. Increase prolactin level, decrease dopamine level, decrease prolactin level, increase acetylcholine level. 6 seconds and go. Pick your answer now. 2 and go. I know. Probably it was fast. All right. But we're now getting faster, 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 doing by instinct. The question is that is response to side effect of blockade G2. G2 is taking a punch right in the chin in the tuberoinfundibular. You know, prolactin is just rising to the stars. Now we have an increase of prolactin and we have the symptoms of many other things that we talked about. Okay. You got to make fun. You got to make it in a way that's understandable to you. There is no right way. It's whatever works for you. The study of what the body does to the drug. The body does to the drug concerning absorption, distribution, metabolism, and excretion. ADAM. We cover ADAM. The question may be in disguise. It can just be what pharmacological terminology is concerned about distribution of the medication in the body. Guys, I give you the knowledge. Dream, how can you use it? Is this pharmacokinetics, pharmacodynamics, pharmacogenetics, or epidemiological? Oh my God, I cannot even say it. 10 seconds. Same way, you know the knowledge, asked in a different way. ADAM. Remember what we talked about ADAM. Okay. I bet you that all of you guys knew it, but the question was asked in a different way. Therefore, you missed, right? So when we talk ADAM, when we talked about distribution, metabolism, secretion, we talked about pharmacokinetics. The body is doing something to the drug. How? How it absorb, how it distributes, how it metabolize, how it secretes. The body is doing something to the drug. Pharmacokinetics. I promise you, you will see this concept, whether it's pharmacodynamics or pharmacokinetics. If you get those two confused, please review. Now, put a big star, highlights. You need to know those in details. Is an easy concept. You knew this in nursing school. You talked about this in research. I promise you did. You probably don't remember. Then you went to your master's, doctor's degree, and you talked again. Do you think this is going to be on your test? You bet. Okay. So it's who of you to know this in detail and don't get that question confused, because it's too easy to get it confused. Inverse agonist does what? Should have given this 20 seconds question, but inverse agonist does what? Agonistic do something, partial agonistic do something, antagonist do something, inverse agonist does something. Does it do blocks binds to the receptor but does not fully activate a receptor by a chemical to produce a biological response, blockades the receptor to inhibit the biological response, binds to the receptor as an agonist, induce unpossible, unopposed biological response. Super, super important.
Inverse. நான் opposite தானே? Yes. Okay.
I am so proud of you guys. I am so proud. I thought more of you guys would get this question wrong. I am super proud. Let's review this, right? Pharmacologic 101. Agonist, I need you to know that agonist activated does something by a chemical to produce a biological response. So agonist equal biological response. Partial agonist is my best. I love the partial agonist because it binds to a receptor but does not fully activate, results in a muted or less potent response. To me, that's the best because if it's missing, it give you more. If it's too much, it takes away. I love partial agonistic. So inverse agonistic and agonistic are what you need to know for your test, most likely, plus antagonistic. Inverse is exactly inverse of the agonist. If the agonist does something, the inverse binds to the receptor as an agonist, but fully, but does not induce unopposed biological response. But so sorry, it binds to the response, but it does exactly opposed of agonist. It takes it away as an opposite of an agonist. It's completely inverse of agonism. Now, the antagonistic is very strong. Once that thing binds it, that doesn't move. Okay, it blocks the receptor and inhibits a biological response. Basically, I'm going to sit in that receptor and I'm going to do nothing. Nobody's going to take me away from here. I want to see who's going to take me away from this chair. It prevents a agonistic from binding and exerting their effect. Think of an agonistic in a scale from 0 to 10. It does the 10. Let's think a scale from negative 10 to positive 10. Agonist comes in, boom, it goes all the way to 10. The partial agonistic, it goes in and says, hey, what do you need? You need the plus or negative. Whatever you need, I'm here for you. The inverse agonist says, I don't care. I'm going to give you a minus 10. Deal with it. And the antagonist said, hey, guys, I don't want to fight. I'm going to sit right here in a 0. Nobody's moving and nobody's taking me away from here. It's the strongest. It sits down right in the receptor and does nothing. You need to know this concept in depth. You will see this on your test. I promise you, in one way or another. Next question. This is part of your PDF, by the way, and it's part of the course. So you need to know this in detail, just like pharmacokinetics, pharmacodynamics. Super easy concept, hanging fruit. You can eat that point in your sleep, but you gotta prepare for it. Which region is the majority of serotonin produced? Where is serotonin synthesized, created, right? And you say serotonin, oh my nightmares think of serotonin. Please do not pick other neurotransmitter. Sleep and mood. That's my serotonin, guys. Is the Raphael nuclei? Is the locus coeruleus? Is the nucleus accumbens? Or is it the angry fear of smell, super fighting amygdala? No, my hippocampus. Don't get that question wrong, please. "20 seconds and go." She's happy. She's blissful. You know, she probably had good dreams with the serotonin. All right, perfect. You need to know where each of your neurotransmitters do and where they are created, synthesized, where do they live? Could you please clarify how NSAID interacts with lithium? What impact it has on lithium level? More importantly, think to yourself, what would you do? The level of lithium is expected to decrease because you took an NSAID, you're in pain. The level of NSAID will increase. The level of NSAIDs will decrease. The level of lithium is expected to increase. This should really be a 30 seconds question. Pick your best answers and go. All right, we have 20 seconds left, just about, and 20 answers. Well, almost 20 seconds. All right, now we do have 10 seconds, 22 answers, and go pick your best answers. Any answers at this point, you're going to miss out. Pick your answer. Okay, guys, please, 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 please. Let's get this question right. Anything that affects your kidneys will affect your lithium level. What am I talking about? ACEs. You need to know that ACEs inhibitors, ACE inhibitors, that is used for two things you need to know. One is used for your heart failure, and two, it's not really that, but I'm gonna say it's used to increase your. Guys, you have somebody have a hot mic. Your ACE inhibitor is used for two things. One is the correct terminology, your heart failure, and two is used to increase your lithium. Incorrect, but for you to know. If you take NSAID, you will double or almost double your lithium level. If you are dehydrated, you will increase your lithium level. What should you do when someone is taking NSAID and lithium? Okay, so drug interactions, anything that messes
Three
with
more
your
questions.
kidneys. Guys, somebody has a hot
Class
mic,
attendance.
please.
It was good. You like it? Okay. Three
Hot
question
mic.
about
Guys, you have to be conscious. You have a hot mic. Drug interaction, anything that messes with your kidneys, it will likely prevent excretion of lithium and sodium. So there is a fight that the lithium and sodium they look alike and the kidney gets confused. Thiazines, diuretics, anything that's blood pressure medication, your thiazides, right? NSAIDs, super important. ACEs, I need you to know that ACEs for heart failure. And second ACEs here is for increasing your lithium levels. Same thing is for ARBs, right? So lithium level will increase with prostaglandin inhibitors. I'm talking about NSAIDs. This is a fancy name, NSAIDs, right? Raising lithium level. What are you going to do, nurse? The patient's in pain. Give him aspirin, give him a Tylenol. That does not affect the lithium level, right? Why? Well, digested by your good liver, right? Don't give a Tylenol if you're drinking. Okay? You don't want to cause harm. But, all right? So, Raphael nuclei is the correct answer. I think it was the previous question. I want you to know that dopamine, the good VTA, the very tired addict, it's part of addiction. And who else? Dope and GABA. VTA, where is it created? Where is it born? Where is it synthesized? Nucleus accumbens and the VTA, right? It's also when you think of dopamine, think of a chocolate, just that gives you a feel good, the reward, right? So it's a lot to do with the dopamine, the VTA, the nucleus accumbens as well. Lucus coeruleus, as you're angry, norepinephrine, fight or run. Nucleus coeruleus primarily produce norepinephrine. Amygdala, guys, I cannot repeat this more 10 times today. It's angry, is associated with motion, processing, fear response, fear, but is not primarily associated with serotonin production. This was the previous questions. Nevertheless, it works for you to further enforce the concept. A 46 years old patient with bipolar disorder arrives at a routine follow-up worried about severe vomiting and lithium 1.6. He should be okay, right? Should he? Keep the patient on the current regimen since he is stable. Um, request an electrocardiogram. Sounds like a good idea. Discontinue the lithium usage and arrange for a lithium level. Sure. Measure the patient's vital signs, which is super important, right? This is what we do for this question. What is the most important action as a new to be psychiatric nurse practitioner board certified? How would you handle this case? Think about patient safety as your answer. Okay. If you ever in your life, I don't care where you are, you think something's wrong, time out. You're doing surgery. What do we do before surgery? Time out, everyone. The person that's cleaning the counter says, "Hey, doc, you forgot to get your tool here." He has the right to speak up. If you see ever in your life something wrong, you stop and then you reassess. Here, you stop the dose and then you arrange for confirmation. Your lithium levels. Do I care about my vitals? Yes. Is the patient talking? Yes. Is the patient vomiting? Yes. Is the patient walking? Yes. Is my vitals super important at this point? No. Okay. Valproic acid, we talked about black box warning. What are they? Increased suicidality. Is that your black box warning? Increased risk for rapid cyclic and mixed bipolar, agranulocytosis, aplastic anemia, or hypertoxicity and pancreatitis. We covered this yesterday. Give me all correct answers if you attend my course yesterday, please. 19 answers. I didn't even finish speaking, and 19 of you guys already got it right. I promise you. 30 seconds left. Then we have some people doubting, about 4 people. We're like, I don't know where to go. I hope you attended the class yesterday, though. And 5, 4, 3, 2, 1. Who is going to win Kahoot tonight? Okay, so let's review this because I don't know if I have a slide after. Sometimes I do, sometimes I don't. Valproic acid is like a punch. It's a punch to your liver. Oh, I hurt. Hypertoxicity, pancreatitis. Do you need to know the distinguish between pancreatitis and hypertoxicity? Yes, you need to know what they look like. I'm not going to cover today. We covered yesterday. Do you need to know what to do? Yes, you need to know what to do. Agranulocytosis, aplastic anemia. My gums are bleeding. What medication am I taking?
Tegretol, carbamazepine.
Tegretol.
Great.
Carbamazepine.
Great, excellent. Which medication causes a decrease in suicidality for my bipolar patient?
Lithium.
Okay. All right. If I have someone with rapid cyclic and mixed bipolar, what is my medication of choice? I'm going to get somebody on this one.
Would you
Who is brave? Who?
repeat it, please?
Okay, I'm going to get someone because I don't think I covered this enough. I have my patient that I diagnosed him with rapid cyclic bipolar, right? So his mood is mixed bipolar. I have 4 choices. I can start him with lithium, Depakote, carbamazepine, or another mood stabilizer of your choice. I'll even leave it as of your choice. Which medication is most likely to work for this patient with
Depakote.
Depakote. Depakote. Do not pick lithium, please. Lithium is the gold standard for mania, for
bipolar,
bipolar, but not for
cycling.
rapid cycling. No, 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 no. Okay, rapid cycling, you pick Depakote. Now, remember yesterday for my borderline personality disorder, we said give lithium for which symptoms?
Anger. Anger.
Yes,
Self-harm.
self-harm, anger.
Angry.
Am I going to give Depakote for which symptoms?
Aggression.
Aggression, just mad, depression, all that, right? All I care is like what I'm going to give lithium for, and the rest I can just say I'm going to give Depakote. I'll throw the dice, right? Same things. This is how you do it between inhibitors. Memorize just one. You don't have to memorize the other. Throw the dice. At some point, if you want to be super duper high speed, memorize both. It's not incorrect. The best tactic. But if you want to just ace the test with easy, memorize one and roll the dice. If it doesn't fall into a list, pick the other one. Okay? Memorize it. Important stuff. Now we come to the best part of the day. Janet, you rock. Third place. AJ, climbing the ranks every time. Now the winner, Tracy. I mean, I should probably get like 21 in a row. We got fourth, Sabi and CB. You guys are killing it, okay? Each one of you guys are just being awesome, absolutely awesome. So this is part of a module 1 of our course, right? We'll cover module 1 in 2 weeks from now. Next Friday, we're going to meet a little bit earlier, so that way I don't keep you until midnight. Okay, that means I'm gonna wake up like 2 in the morning, something like that, so I can meet with you. You are important. Your success is what inspires me. So everyone, 100% pass rate 6 weeks from now, or the most. I want to clear all the students. 6 weeks from now, all 200 of you guys will be done. 100%. Follow me. First thing that I want you to do right now is a schedule test. We're going to do this with high intensity and purpose. High intensity and purpose. We're going to do this to pass the board. If it's your first time, it will be first time go. If it's your second time, don't despair. We are here. We'll help you. Okay? Now, I want to emphasize one thing. Please, please, please help me help you. You have a question. You have concern. You don't know where to go for your question bank. We have 1,400 questions. You have a question with the question bank, email me. Your WhatsApp group is for you to share experiences. It's for you to communicate with other students. It's for you to ask for help. All right. So don't send me a message. Oh, I can't log in, because then I have to send you a message back and say, what is your password? And then you wait 2 days and I don't get back to you. Right. When you email me, I can solve the problems. I have 20 different social media and I love to talk to you. And I hate when I'm delaying talking to you because I didn't see your message. So you have to email me. Second thing is, keep the WhatsApp group for learning, guys. Nobody wants to be like, oh, I can't log in. I can't find this. You know, if you can't find, come to me. I'll help you. I'll be more than happy to help you. My job is to help you. Okay. So, yeah, guys. So this is it. Like, this is it for the end of the day. I am going to put the course here. If you happen to be someone that you're inspired by today's event, if you're inspired by how we do things, if you are committed to 100% transformation of your learning, The link is available right here for a nice discount, right? Still getting like $100 discount. When you compare what you getting for what you paying, you are paying nothing more than one night in an expensive hotel on a vacation. And you're getting me for 6 months, for a year, or as long as you take to pass. Literally, I could be working for $1 a day. Literally, right? If I do my patient care, if I just want to make money, I'll do 10 encounters a day and I'll do, like few days of follow ups and I'll make $500 for each encounter, right? I'm doing this because I absolutely love the communication, the learning. This is part of me. I'm about to retire and I want to do this. All right. I'm doing this for monetary reasons. Yes. I get some money, but I pay more than what I make for now, at least for the past 2 years. But I'm here for you. Right. If you need to do 6 months, is what you get. Need more time? You never see me denying you more time. Need more life happens. Somebody died. You're going through a divorce. I don't want you to take your test like that. I want your best taking the test. So I'll give you more time. Whatever you ask me, I'm a yes person. My weakness is my heart. All right. If you need more, ask me. Something's not working out, ask me. Let's work that out. So at the end of the day, I have people that are in the program for longer than 6 months. If you're gonna realize it, like I work for 50 cents a day, right? It's okay. I'm not complaining about it. I'm just happy that you're part of the program. I'm happy that you haven't give up. I'm happy for those that have been in and out, like Barbara. She came in and destroyed the test in 21 days. But that girl was on the course every single day for 2 hours. She sat apart 21 days, 2 hours a day. She never attended the live reviews and she destroyed the test. Absolutely destroyed. Because how do I know? She was scoring 85, 90 on the pre-test first time. Man, she walked away from that test and said, that was a joke. But why she felt that way when some felt a little bit harder or some have failed is your preparation. We are in for a battle and we are in for your transformation. The battle day will be like a training day, super easy. The training will be harder than the battle day. Okay, if I'm talking Greek to you, is normal. That's how I talk. That's how I deal with people on my daily interactions. But intensity, purpose, and victory. Okay, and your transformation. At the end of the program, what you get? Passing, sure, that's a giving. But what you get is a transformation. What you get is a confidence. What you get is like, I went from barely thinking that I could pass to, hey, I want to do a psychoform because I'm inspired by the program. Right? So, and that's my goal. I will 5 minutes break. We'll meet up at 8:20, and then we go over maybe a few questions that you have. Like, I don't understand this. You need to do a better job on this, and I'm here for you. And then we'll do that. And then we kind of go over the program, which I think I have explained it in depth. You get live reviews. How many sessions can you attend? As many as your heart desires. I don't say, oh, you bought a one, you can only attend one. No. How many times can I stay in the program? 6 months. Do you need more time? Ask. All right. Don't have. Does it include the question bank? Yes, includes the question bank. Does it include the diagnostic test? Yes, includes the diagnostic test. Okay. Everything you need is included. You don't need nothing else, not a penny more, nada. You offer me money to meet with you, I'll meet with you for free when possibly can. Okay, I have a very, very busy schedule, but I do not mind if I have to wake up at 4 in the morning to meet with you. Promise you. I actually feel glad that you asked. Leadership, I lead a lot of people. I have a lot of, I'm not gonna say, but I do lead a lot of people. My failure is when people stop asking me. Do you know why? Because they have lost the trust. When they say, I'm not going to Dr. Lopez because X, Y, and Z, I lost them. It's not their fault. They don't trust me. So I have to ask why. Right?
Mm.
As long as people bringing me problems, I know that we still are team. Don't mind when you have problems. 5 minutes break. See you again 8:20. Okay? Bye-bye.
Mm. 5 minute break.